Hi everyone. I just want to give you a little extra guidance on how to really format and write this final critical appraisal paper in a way that sounds scholarly and hopefully somewhat similar to the articles that you're actually reading. This is something I would have loved to have more time on in class, but as you know, this class is very short and intense, and I wanted to make sure you got all the content regarding just identifying your articles and appraising them first. So, this is just giving you some extra ideas on how to format your paper and write it with a scholarly tone. So, in the introduction, this is a very important piece of your paper. A lot of you did really well with this already, but I just want to give you further guidance on how to structure your introduction. I always encourage you to read the scholarly articles that you've already looked at, either for your critical appraisal paper or for your EBP project. They will also offer good examples of how an introduction is structured in a research article. Basically, the first section, you want to start off right away with really strong statements about your problem. You want to make those strong claims that talk about just how big of a problem it is. You want it to be very compelling and gets the reader interested right away. It's important to use evidence, meaning other sources in the literature. You may use a textbook, although a lot of times textbook statistics are a bit outdated. So I recommend gathering a few additional articles on your topic outside of your critical appraisal article to help you with this section and kind of boost your evidence. You can use systematic reviews. They'll offer great information on your problem or whatever you want to do, but I would just strongly suggest getting at least 2 to 3 additional articles on your topic for this section. And you want to be able to give information about the prevalence of the problem, how widespread it is, either globally, nationally, or if you're focusing on a state issue. Make sure you're giving statistics, and as with everything, you need to always cite sources for all of this information. Depending on what your problem is, you may need to actually explain it or describe, like give a definition for your problem. If it's hypertension, what is the actual systolic range and diastolic range given for that? If it's low birth weight infants, what is the exact weight range parameters for that? So in some cases, you may need to actually explain your problem in more detail. And then once you've really gotten a good idea of the problem and the prevalence of it, then you'll want to talk about the consequences of your problem. So what happens when this problem occurs a lot? Do you have mortality rates that go up? Do you have other morbidity issues? Does it cause other health problems, major health problems? For some of you, it may cause financial problems within your hospital, especially if you're looking at the lack of reimbursement because of your issues, such as having a fall. And then maybe it affects staffing, or it even, in some cases, maybe it affects staff satisfaction, nursing satisfaction in particular. So these are the things you want to be thinking about as you're really making a strong case about the big problem that is out there. In the second section of your introduction, so this may be a second paragraph, you're going to want to discuss what's currently being done about your problem. So we call that usual care. What's current nursing practice right now? So you want to describe that and kind of indicate why that's not a good way to go, why that's not working. And this is where you may have possible statistics to back that up. In the group that's doing CLABSI rates, so catheter line associated bloodstream infections. And if you're looking at usual care being the scrub the hub, are you able to find statistics on what happens when you use scrub the hub? So what are the problems potentially associated with usual care specifically? That may not be applicable to all of your problems and all of usual care for each situation, but that's something to be thinking about. Then you're going to want to introduce your intervention of interest. So this is the I in your PICO, what you're going to be exploring in the literature. So make sure you've introduced that, and perhaps you even have a little bit of literature already to give ideas as to why that might actually be a better way to go about things. I'm thinking of the group that did cancer pain, and they looked at pregabalin as a possible intervention, and you may have some just information about the mechanisms of action regarding the different types of medications, pregabalin versus opioids, for specific neuropathic cancer pain. And so you may have an explanation pathophysiologically and with the mechanism of action of different drugs to explain why your intervention might be more helpful. This is more of just a plausible section because you haven't done a full review of your article yet in the paper, but you want to at least introduce your possible intervention and why this is a possible or better choice. Before I talk about tips for writing style, I just want to accentuate, I didn't include this in the PowerPoint. Please, please, please don't forget to include a section on, or at least a statement or two on how this problem affects nursing. For most of you, it seems obvious how it affects nursing, but you need to explicitly state that in your paper, why this is a significant problem that affects nursing. Either the problems that nurses have because of it, how nursing is maybe a part of the problem, or at least how nursing can be a part of the solution. So as we wrap up the introduction, there are specific tips for how to write an introduction besides the formatting that I just gave you. One thing that I saw in a lot of rough drafts is that you are using authors' names and or titles of articles in the actual text. This is really something to avoid. I know that you may have been taught in earlier years that it makes you sound more credible to say, according to so-and-so in the article titled such and such, and then you give your information. Actually, according to scholarly writing, it's just considered wordy. It's not necessary. It takes up space. Scholarly writing is all about saying what you want to say in as few words as possible, being substantial but concise. So really avoid doing that and just simply state your claims and then cite your sources in parentheses at the end. You really don't need to include that kind of information in the text. And most times it's not even necessary to say in one article, blah, 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 blah. You don't even need to mention the article explicitly. Just state the information and then tell us in parentheses where it came from. Also, make sure that every single idea or claim that you state is cited in your text. If you did not personally observe this problem, you have to cite a source when you're talking about it. So that means that almost every sentence in your introduction needs to have a source cited. And please make sure that if a source is cited in your text, it is also included in your reference page and vice versa. Only things in your reference, everything in your reference page should also be able to be found in your text. It goes both ways. The PICO section should be relatively short. But what's important is developing a transition sentence. So making sure that you're connecting your introduction to your PICO question so that it makes sense, so that it flows. So develop some sort of transition sentence that connects those two. When you're identifying your PICO, make sure you have all four of those components clearly identified. I was suggesting in class that you actually put a P in parentheses behind your population, an I in parentheses behind your intervention, and so forth. You do have some creativity and flexibility on how you word your PICO. It does not have to be in an actual question, although that's totally fine. You may use it as a purpose statement. The purpose of this paper is to explore blah, blah, blah. So there are many ways to do this, but make sure that it's very clear and identifiable to the reader. There's not too much to say about search strategies. Most of you did a really good job on this section. The main point is that a reader should be able to replicate your actual searches by following your steps. So you basically just need to say, based on your PICO, because your search terms should have come from your PICO, what database you searched, what the search terms were you put in, and then how many hits you got or how many articles were resulted in that search. Of course, you have to repeat that at least 2 times. That's required in the rubric. If you have any limiting parameters that you used, either by dates, by language, by type of journal, whatever that may be, make sure you include that as well so that the reader can see exactly what you did and be able to follow that if necessary. So before you start the official article synopsis, make sure you introduce the actual article you've chosen. This is the only time you will need to actually write out an article's title in the text and formally introduce the article. Okay, so and in this case, you would also need to say what search it came from. Did it come from CINAHL? And if you did multiple searches in CINAHL, what search did it come from? So that readers can see exactly where you got this article, how you found it. And then you're going to go through the 6 elements that are located in your rubric, the types of things you're going to review. Again, I would use for this synopsis section, I would use the critical or the reviewing form that we used for the Cotty article way back in week 3. It's posted in module 3, the blank form that you can use. I recommend you filling that out. It will just help guide you in getting all these elements. That review form probably has more than these 6 elements, so don't address them if they're not in the rubric, but you do need to cover these 6 components. You do need to identify what is the purpose, the aim or objective statement, the sample, the methods, the study design. That is simply stating what is the study design. Is it a randomized controlled trial? Is it a quasi-experimental study? Is it a correlational study? If so, what kind? Is it prospective, retrospective? So maybe you have a descriptive study where it's more of a survey study. So check back in week 3's PowerPoint, and that will have, or in your text as well, and that will have all the different types of studies that are there. For the findings and results, this can get a little bit confusing. Basically, what you want to do is you're going to choose the most relevant results. There will probably be a ton. You want to pick the most relevant ones. Usually it's the ones related to the primary outcomes that were identified earlier in the study, usually in the methods section. If this is still hard for you to find, I recommend going to the abstract because the authors are putting in the abstract what they think are the most important pieces of their study. So I would find those results. You need to identify what stat tests they used to get the results. Just give the numbers, and then you need to summarize what that means. What does it mean to have a p-value of such and such and a mean of such and such? And that's just very simple, a sentence or two, just interpreting what that result means. In the limitations section, the author should state limitations of the study. This would be in the discussion section of your article. If they don't state limitations, then you're going to need to offer at least a few ideas of possible limitations that you saw in the study. And then strengths, usually the authors won't say strengths, and so that will be something that you will also need to identify. I recommend writing out at least 2 strengths that you have identified that you think are great things about the study. This could be related to sample size, it could be related to the type of intervention, it could be related to the study design, the length of time done for collecting data, maybe the instruments used. So there are lots of different things that can make a study strong. And so that's what you would want to briefly mention there. In the critical appraisal section of your rubric, so as you can see, these slides are just going chunk by chunk. Each session, the rubric is kind of a new slide. You're welcome to also use these types of headings as level 1 headings if you'd like. A synopsis section, an appraisal section. If you want to break it down even further, like for example under the critical appraisal first level heading, you could do a level 2 heading for validity, a level 2 for reliability, a level 2 for applicability. That's up to you. You may not need to do that. It's totally up to you and how lengthy you feel this section is and if it needs to be broken up. In the first part of the section, you do need to identify the level of evidence. This is reflecting back on what the study design is. So you'll need to say again what the study design is. And because of that study design, it is a level what evidence? Is it level 2, level 3, level 4, level 5? That's all you need to say for that. When you're talking about problems of validity, reliability, and applicability, again, you're going to want to refer to the second form we used for the pregnancy and alcohol study. That's called the Rapid Critical Appraisal Form. That is located in Module 4, the blank form on Canvas. And that's broken up into those sections. And so it asks questions based on validity, reliability, and applicability. Fill that out for your article. Use those answers to formulate your discussion on whether or not the article is valid and reliable and applicable. Maybe it's somewhat valid, but not all. So these are not black and white answers. This is you discussing were there problems related to validity, were there strengths related to validity, and same with reliability, problems, strengths and strengths related to applicability. Make sure when you're talking about each of these categories, if you don't have subheadings for validity, reliability, and applicability, make sure you're explicitly identifying that you're talking about those things and you're talking about whether or not the article is or the study is valid and reliable. Okay, so this is all talking about external validity and reliability. If you do have an article that actually uses measurement tools or instruments, and the authors identify the reliability and validity information for those tools, please include that information as well. But for some of you, there's no measurement tools that would apply to that, or they don't have a specific measurement tool. The last section is your recommendations. And these are just some questions to get you thinking about this section. So based on your appraisal, would you recommend using information from this article? Basically, was it high quality evidence? So was it high on the level of evidence pyramid or its chart? Was it valid according to your appraisal? Was it a fairly reliable study according to your appraisal? So that's all the pieces that go into saying, is it high quality evidence? And then not only that, but maybe it's high quality, but it's not really something that could be replicated in real life or in your clinical setting. So that's where you really need to think about your own setting, and does this information apply? Or maybe it needs to be adapted in some way. And so how do you recommend adapting what you've learned from this article to your own clinical setting? In this section, you are really writing as the expert in your field of nursing, and you're really recommending how these researchers can really apply what they've done to real life. Or maybe not. Maybe your article is completely inconclusive in the results, and you just want to talk about that and maybe give further recommendations for research in this topic or exploring a new intervention. This is, again, really up to you, and really where you're displaying your critical thinking and acting as an expert in your field. There is no conclusion section per se in the rubric, but it may be necessary to write a brief conclusion paragraph after recommendations to summarize everything that you've written about your article and what you recommend going forward. It's kind of up to you and your writing style, but that may be something that would be helpful for you. So this is my last bit about tips for writing style on the second half of your critical appraisal paper. It is in the rubric, but I would just want to accentuate, please, please, please do not use direct quotes. Direct quotes should not be used at all throughout the entire article, actually, or throughout your entire paper. Basically, what that does when you use direct quotes is it takes away your own credibility. It basically shows that you are not able to take the information that you've read and interpret it in your own way. So that is what I want to be able to see, is that you can summarize information, you can synthesize it, you can pull information from different sources and come up with conclusions. And so that needs to be done in your own words. Of course, you need to cite every source that you get information from. So it is not bad at all. It's actually a good thing to have sources cited after almost every sentence, but it is not a good thing to use direct quotes. So please do not use any direct quotes. Now, if you are in the second half of your paper, you're going to be pulling all from one article, the article that you've chosen to review and critique. So because of that, you don't need to cite your source after every sentence. That's pretty redundant. The way APA says you can do it is you can just cite the source at the end of the paragraph. So for each paragraph that you're writing about the same source and only that source, you're able to cite this source just at the end of the paragraph. When you start a new paragraph, you have to start again. And then if you're again using just that source, you would cite it at the end of that paragraph. My last piece of advice for you in this is to not use personal pronouns. This is a big no-no in APA and in scholarly writing. Do not ever use I, we, us, etc. Especially in your, some of you might feel that you need to use that in your recommendations or in your search strategy section, and you really cannot do that. If you feel absolutely necessary to refer to yourself, then you would need to say this author, but you cannot use I. Last but not least, I want to leave you with this quote. Dr. Ringen introduced me to this quote, and I absolutely love it, and it is simply progress, not perfection. When it comes to understanding research and learning how to write in a scholarly way, it is something that You may never feel that you fully get. I know for me, it is totally a work in progress, and I am learning every time I teach this class, every time I write a paper. So please don't be too hard on yourself. Know that this is all about just learning, the learning experience, progressing in this new field. I have had students say that research felt like learning a new language. I completely agree with that. So give yourself grace and know that you are improving. You've learned a ton in the last 6 weeks, and I really look forward to reading your final product. As always, if you feel that you are still really confused and have a lot of questions, please don't hesitate to reach out to me. I'm happy to give you guidance in any way that I can. Best of luck.